As we age, our bodies undergo numerous physiological changes that may not be visible on the surface. That's why regular blood tests play a vital role in monitoring the health of older adults. Blood work can detect early signs of disease, monitor organ function, and ensure that nutrient levels are adequate, all of which are essential for maintaining health and longevity in later life. Early detection of health issues. As we age, our bodies naturally undergo numerous internal changes, many of which may not manifest with visible symptoms right away. This is why blood tests are such a powerful tool in safeguarding health, especially for older adults. Conditions like diabetes, heart disease, and kidney dysfunction often begin quietly, progressing over time until they reach more advanced and dangerous stages. For example, high blood sugar levels can exist for years without causing noticeable discomfort, while silently damaging nerves, vision, and blood vessels. Similarly, cholesterol buildup in the arteries and early kidney damage rarely produce symptoms until they become critical. That's where routine blood tests come in, tests such as fasting glucose, A1C, which measures average blood sugar levels over 3 months, lipid panels to assess cholesterol and triglyceride levels, and creatinine or eGFR for kidney function. These provide vital insights into your body's internal state, often years before a condition would otherwise be diagnosed. Early detection through such screenings gives patients and doctors the opportunity to take action before complications arise. By identifying a problem early, you can begin treatment when it's most effective, whether that's through medication, lifestyle adjustments, or both. To take full advantage of this, seniors should get a comprehensive blood test at least once a year, or more frequently if they have risk factors such as obesity, high blood pressure, or a family history of chronic disease. It's also important to track these results over time, not just look at them in isolation. If you notice a gradual rise in glucose or a dip in kidney function, even if still within normal ranges, that could signal a trend worth addressing. To improve your health outcomes, maintain a healthy diet, stay physically active, keep up with your medications, and work closely with your healthcare provider to monitor and adjust your care plan as needed. Early detection is not about fear, it's about empowerment. With the right knowledge and timely action, you can stay one step ahead of potential health threats and enjoy a longer, healthier life. Monitoring medication and treatment effectiveness. As individuals age, managing chronic conditions often requires taking multiple medications daily. While these medications are necessary for treating ailments such as high blood pressure, diabetes, or arthritis, they can sometimes place added stress on vital organs like the liver and kidneys. Older adults in particular are more susceptible to these side effects due to a natural decline in organ function with age. This makes regular blood testing an essential part of monitoring treatment effectiveness and overall safety. For instance, liver enzyme tests such as ALT and AST can reveal if a medication is causing inflammation or damage to liver tissue. Similarly, tests measuring creatinine levels and estimated glomerular filtration rate, eGFR, help evaluate how well the kidneys are filtering waste from the blood, which is especially important when medications are metabolized or excreted through the kidneys. Even common medications like pain relievers or certain antibiotics can have unintended effects if not properly monitored. In some cases, a drug that was once well tolerated may start to cause harm as the body's ability to process it declines. Regular monitoring allows doctors to catch these changes early, make necessary adjustments to the dosage, or switch to safer alternatives. This proactive approach helps prevent complications such as medication, toxicity, organ damage, or dangerous interactions between drugs. To ensure the best results, older adults should maintain a detailed list of all their current medications, including over-the-counter drugs and supplements, and share it with their healthcare provider during each checkup. It's also helpful to have routine blood tests scheduled every 6 to 12 months, depending on the complexity of the treatment plan. Being proactive with medication monitoring not only protects against serious health risks, but also ensures that treatments continue to work effectively, improving both longevity and quality of life. Tracking nutritional deficiencies. As the body ages, its ability to absorb and process nutrients gradually declines. This often leads to nutritional deficiencies that can go unnoticed until symptoms like fatigue, muscle weakness, cognitive decline, or frequent illness appear. Blood tests play a critical role in identifying these hidden deficiencies, especially of key nutrients such as vitamin B12, vitamin D, iron, and folate. For example, a deficiency in vitamin B12 can lead to memory problems, confusion, and even irreversible nerve damage if left untreated. Low levels of vitamin D are associated with increased risks of bone fractures, weakened muscles, and a compromised immune system. Iron deficiency, meanwhile, can cause anemia, resulting in chronic fatigue and shortness of breath. Detecting these imbalances early through routine blood tests enables timely intervention through dietary changes, supplements, or adjustments in lifestyle. To improve outcomes, older adults should request a comprehensive nutritional panel at least once a year during routine checkups. Maintaining a balanced diet that includes a variety of colorful fruits and vegetables, whole grains, lean protein, and healthy fats also supports nutrient intake. For nutrients that are commonly low in seniors, such as B12 and D, it may be necessary to include fortified foods or doctor-recommended supplements. Regular monitoring not only helps correct deficiencies before they cause serious health problems, but also ensures that aging adults maintain the energy, cognitive sharpness, and immune resilience needed for a vibrant, healthy life. Managing chronic conditions. Managing chronic conditions becomes increasingly important as we age, especially for seniors dealing with hypertension, high cholesterol, diabetes, or thyroid disorders. These conditions often require lifelong monitoring and fine-tuning to prevent complications. Routine blood tests serve as a critical tool in evaluating how well these conditions are being controlled. For instance, lipid panels help track cholesterol levels, thyroid function tests assess hormone balance, and A1C tests provide an overview of long-term blood sugar control in diabetics. Without regular monitoring, seniors may not realize when a condition is worsening or if their current treatment plan is no longer effective. To stay on top of your health, it's important to schedule regular checkups with your healthcare provider and request comprehensive blood work tailored to your condition. Keep a personal health record to track your results over time and look for trends or changes. If you notice symptoms like fatigue, weight gain or loss, or unusual swelling, share them with your doctor as they may indicate a need for medical adjustments. Follow your prescribed treatment plan, make dietary changes as needed, and don't skip follow-up tests. Staying proactive through regular blood monitoring ensures that chronic conditions remain manageable and less likely to interfere with your quality of life. Conclusion: blood tests are more than just numbers on a chart. They're a window into your internal health. For aging adults, staying proactive with blood work is one of the most effective ways to maintain vitality, catch health problems early, and live a longer, healthier life.